Hi, I'm Dr. Stephen Stokes, and welcome to my garage. I was just out here doing some exercise. I try to get some exercise every day. And I was thinking about back pain because so many people suffer from back pain, and one of the problems with it is it prevents you from exercising, from moving, right? Prevents you from going for walks, prevents you from maybe doing some weights or some band work. And if you don't move, if you become sedentary, then that fuels the disease process. I find clinically back pain is the #1 complaint, right? And there is a great tool that you can use if you're suffering from any type of back pain that can not only help alleviate your pain very quickly, but has been shown through a lot of research with pre and post MRIs to actually repair the injury, repair the damage. And in most cases, the damage is the spinal disc. So come with me, let's go into the house. I just wanted to do a video like this in the beginning because people call me on my cell phone and I answer and they always say, I can't believe you answered the phone. They think that I'm in some big office somewhere or I'm some untouchable sort of personality. It's not true at all. I'm just a normal person. I really enjoy helping people. This is my home. I live here in Cape Coral, Florida. And here's my office. This is where I do my consults, where I make all my videos. I just wanted to show sort of a behind the scenes on that for a brief moment so you get an appreciation for the fact that I'm definitely accessible. Today we're going to talk about these DDS belts, these spinal disc decompression belts. Let's get into it. Okay, so I'm back, and for some reason I wanted to do that today. I just wanted to sort of, be like a YouTuber and walk around with my camera in my house. Sorry about that. But we're back, and I'm here in my office, and what I want to talk about is this DDS belt from Disc Disease Solutions, which is a company that I've been affiliated with for maybe 15 years. When I was in clinical practice, we recommended these all the time. John, the owner of the company, tells me that they have sold over 1,000 of these devices over the years based on my recommendations. And I have myself here at my house a couple of these. I use this myself. My father, Doug, uses it on his back, and he has spinal stenosis. My sister-in-law, who's a rancher from Naples, used it to totally reverse her back pain. And so it's a great device, and it works really good in most cases of back pain because it addresses the root cause of back pain, which is normally the spinal disc. The spinal disc is this cushion between the bones that acts like a shock absorber. And under normal circumstances, that keeps the spacing between the bones apart so that the nerve that comes out doesn't get pinched or irritated. But if this cushion breaks down through either trauma, like a car accident or a sports injury, or just wear and tear over time, what happens is the cushion loses fluid, it dehydrates, and then the disc gets thinner, and the space where the nerve comes out gets smaller, and the nerve can get pinched and irritated. Also, as that cushion becomes dehydrated, it becomes brittle, and it becomes susceptible to tearing and cracking. And when that outer ring of that cushion, the annular fibrosis, when that tears or cracks, it releases essentially like an acid material, but it releases chemicals into the surrounding tissues that cause pain, activates something called nociception, which is pain. And so that is the normal cycle of chronic back pain, this injury and re-injury of these spinal discs. Unfortunately, the spinal discs are very difficult to heal because they're avascular, which means there's really no direct blood supply that goes into those cushions versus like a muscle. A muscle is completely filled with vascularity. That's why they heal so good, right? Muscles usually heal very quickly because they're filled with blood and they have lots of access to blood. But the cartilage of your body and the spinal disc, which is a form of cartilage, they don't heal very good, right? Neither do ligaments because they're typically avascular, or certainly they have a lot less vascularity, a lot less blood vessels that feed them than muscles. I want to get more blood and oxygen and nutrition going into that degenerated, shriveled up, dehydrated cushion get as much of that fluid getting there as possible, and that will activate a self-healing mechanism called the pump mechanism in the spinal disc, and it will naturally begin to heal. And they do heal. Not only do they heal, but the degeneration can reverse. Now, it's not going to reverse completely, right? But it can reverse enough that it'll take the pressure off of that spinal nerve, which is what you're after. How long does that take? If it's done properly, not very long, right? Usually 4 to 6 weeks, you'll see dramatic results. Normally, in the first 10 days of the therapy that I'm going to recommend, you'll see a 50% improvement in your pain levels, which is amazing. And of course, as the pain goes down, as the cushion expands and gets fatter and becomes more effective at keeping the space open where the nerve comes out, you can start to do things like walking and exercise, which are essential, right, to maintain the flow of blood and fluid into the cushion. But if you're hurt and you're guarded, you can't do that. So one of the great things about this decompression brace that I'm going to show you is that you can wear this even if you're injured to take pressure off the nerve and to allow you to go out and walk and do activities that is going to long-term promote the health of your back. So it's called the DDS belt. It's made by a company called Disc Disease Solutions. And I want to show you very quickly what you get and what it looks like. And by the way, DDS is an amazing company. There's a link on my website if you're interested where you can get it at a discount. Use the code Dr. Stokes. Or give them a call there and mention my name. They know me very well. I'm on their website. I was involved with this company for many years, like I said. And what's great about this company is that they will ship you this device, and they will give you a 60-day money-back warranty on the device. So if you get this, if you use it, if you find that this is not working for you, right, and it's just not for you, it's not for everybody. I would say less than 10% of people that get the device find that it's not helpful, but it's not for everybody. If you get it and it doesn't help, DDS will take it back and refund all of your money. No questions asked. How can you beat that, right? You can't beat that. So it comes like this. Make sure that when you get this, that you measure your waist size from the belly button. A lot of people underestimate their waist size and they get it too small. So make sure that you're measuring at the belly button for yourself. That's the key. And then, there's a chart you can get the right size. So it comes like this, and let me show you how it works. You take this device, you apply it like this, right? Then there's a safety strap here that goes to the side, okay? This will line up with your belly button, and then it comes with this pump. And the pump is a gauge, green and yellow and red. Obviously, you want to stay in the green. And this attaches here to the valve. You start to pump. Right? That's at about 12 psi. Take that off. And what's happened here is that the device has expanded. And as it's expanded, it's taken those bones and it's opened them up to take the pressure off of the spinal disc. Right? You wear this for a minimum of 2 hours a day, and when you're done, you come over here to the valve, release the valve. See it compressing, going back together again. That's the treatment, right? Hey, hope you could hear that. And so again, it has some accessories. It comes with a manual. It comes with a wash bag that you can put this in the washing machine, hang dry. And it comes with a extension valve that I should have showed you. Let me open this up. So it comes with this, and you can attach this here to the belt, and it makes it a lot easier to fill it, right? So I'll just show you that quickly. Voila. And you don't blow. You use the pump. But again, extension valve, when you're done with that, it'll just tuck down inside here. So this is a great device for anybody suffering from spinal stenosis, herniated bulging discs, protruding discs, torn discs, facet syndrome, right? Degenerative disc disease. These are the conditions that are at the root source of most chronic back pain. Even if you think that it's just a pulled muscle, if you're getting reoccurring pulled muscles, it's probably a disc that's been injured, and the muscle guarding, the muscle pull or the muscle tightening is just a defense mechanism. So I really encourage you to look into getting one of these devices. More information on the website, like I said, with discount coupons. If you get one, say hi to John for me if you call there. Use the discount code. And feel free, as always, to reach out to me. I'm available. You can text me on my cell phone, call me on my cell phone. You can talk to me through the chat feature on the website. I'm always available, guys. I do this all the time. I enjoy it. I don't charge for information. So if there's anything I can help you with, let me know. Make sure you watch the other videos. I've got some other good videos on other things with back pain as far as herbs and stuff. But I just really wanted to focus today on the DDS 300 spinal decompression back brace and why, if you're having chronic back pain, it's a great device for that. Or if you're somebody that just is very cautious of your spine, you want to keep your back healthy, nothing better. Get one of these devices. Go for a walk every day for, say, 20 minutes. Use the belt while you're walking, and it will open that up, decompress gravity, decompress the compression on that, right? No pressure means no pain, and allow the fluids to go in and out of that area as you walk. Thanks for watching. Give a thumbs up and subscribe to the channel. I'll see you again soon. Bye-bye.